Let's talk more on that story now. We're joined by the South African Medical Association chairperson, Dr Mvuyisi Mzukwa. Dr Mzukwa, very good evening to you. So the case not being enrolled today, Matthew Lani basically walking free, does this draw a line under the saga for you as a health professionals association?
Good evening to you, Tembekile, Kathy, and your viewers, and thanks for having me in your program. It is a concern for us, for when we see, fake practitioners who appear in the public and even are employed by the state at times or used by the state in their platforms, social media platforms. And, and then, there's no build-up of a case against the person, because we thought that, if there is an arrest, then people have got some evidence that they can present before the court of law. We're concerned about the fact that at this point in time, it will continue to erode the trust, in healthcare professionals and the system as well. So we do think that, something drastic will have to be done in the future, when there is evidence, around this deceiving of the public, and also, the misinformation that gets to the public.
Right, because the NPA says today that it does not have any evidence that Matthew Lani actually committed any crime, but even in the days after he was exposed online as having lied about obtaining or holding a medical degree, he made, I think, 2 or 3 videos subsequent to that, still insisting that he was a qualified doctor, even after the likes of WITS and the HPCSA had said they had no such record from him. But now they're saying, the NPA at least legally, all he did was tell a lie and they can't prosecute him on that basis. So what prevents other people from pulling a similar stunt?
Yeah, like I said, it's very concerning, but also it exposes some loopholes within, our legal entities, because it looks like the legal entities are not working in unison, because you'd expect that, if you've got HPCSA, telling the public that this person is not registered, you've got an institution like WITS coming up and saying, no, this person was never our student. These are public entities. You would expect that there would be coordination of, of some sort, to make sure that, there's protection of the public, because the main mandate of the HPCSA is to protect the public. And, we would expect everyone in the country to be concerned about, misinformation and the fake news that are out there in terms of advices, medical advice that is given to patients. So to us, it's a huge concern that there is no coordination around the protection of the public.
And if Lani did not, for example, impersonate or take the identity of any other doctor in the system, because there was a concern when the story broke that he may have in fact used someone else's name and surname, for example, to dupe possible patients and others who may have been following him on TikTok. So he did not impersonate a particular individual. For example, he did not treat, they're saying, any people or patients. Should he still be punished for lying?
Well, I wouldn't really speak directly to the merits of this case, because I personally don't have the evidence. I don't think the medical profession or the medical association has got evidence. But we're worried about, this trend that has became prominent during the pandemic, COVID-19 pandemic, where people just emerge as healthcare professionals giving advice, because some of these people are giving advice. They are selling out healthcare products, to the public. They use these platforms. It's not just, you can't tell me that you'll be wasting your data just on entertainment and you don't expect to have something in return. I do think that there is something deeper than meets the eye. So we do need to get deeper to this, not only with Matthew, but with all other people that are implicated in terms of misleading the public with healthcare, presenting themselves as healthcare professionals.
Am I right to say, Dr. Mzukwa, that the challenge for bodies such as yours is that because he's not a registered healthcare professional, there's nothing you guys can do about this, whether you're satisfied with what happened in court today or outside court, in fact, or not?
Ours was really a concern that the public is not protected. What we were pushing for was for the HPCSA to come up with a plan, a coordinated plan, to protect the public, identify the stakeholders, come up with a plan of how do you protect the public, because obviously it seems like everyone is emerging and selling out products. I mean, people are using, even this guy has appeared on TV, has appeared on, has spoken on radio stations, and nobody has, been verifying this person, whether this is an actual doctor or not. And some of these products, they come out on newspapers, and people, when they see it on media, they trust it. So I do think that there's a great need for all of us, to work together as stakeholders and come up with a plan that will protect the public. Ours is the main issue is that the public must be protected. Nobody must deceive anyone, and come up, emerge as a healthcare expert when in actual fact you've not received any form of training in this regard.
The other challenge when we spoke to the health department on the show last night was that ultimately no one can actually say how many imposters are in the system, and so far the greatest protection, for example, is still dependent on us, the patients, checking if there's a legitimate registration or a practice number, and if that does not check out, then reporting it to the authorities. How do we improve that sort of mechanism to make sure that when there are indeed imposters in the system, they're caught out and caught out quite early?
Temekile, I must commend the HPCSA. I don't always commend them, but this time around I must do that. They have what they call the inspectorate unit. They're going out in the communities, identify these practices themselves. But I think what they need to do is, one, to empower communities on how to identify these fake practitioners easily. But also, they need to partner with other stakeholders. They need to have a tangible plan on how to, clamp down on this, by partnering with other stakeholders in a very collaborative manner. It can't be that it's going to be that inspectorate unit that is going to go around the country inspecting practices and stuff like that. There are churches on the ground, there are councillors, there are political parties, that should be out there protecting the public. It can't be that they are just there, for them to receive votes and not do anything in terms of protecting the public.
Dr. Mvuyisi Mzukwa, good to speak to you from the South African Medical Association, chairperson of that organization, speaking to us tonight on News at Prime.